imagine this. You're playing a basketball game with a friend. The game is getting very intense, and then all of a sudden, you see your friend fall to the ground and huddle up in a ball like this, and then they start to scream, no, 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 or it's not true, it's not true, it's not true. Would you know what was going on with your friend and how to help them? Would you know that they're having an anxiety attack, and that by repeating those words, they're showing signs of having compulsions from fearful thoughts? This past year of college, I was diagnosed with OCD. I was not planning on it, it just happened. My compulsions were words, just like the example that I just gave, and not actions. And so that makes it very, very hard to diagnose. Today I want to inform you on the things that you've never heard probably about OCD and how to recognize and treat it. Let's start with what OCD is. OCD is an anxiety disorder that causes a person to feel the need to check things repeatedly or have certain unwanted thoughts or perform routines or rituals over and over and over again. People cannot control these obsessions and these compulsions that have OCD. So next, let's look at some signs and symptoms of OCD. First, OCD is not just about germs, like you see most people repeatedly washing their hands. That is a form of OCD, but that's just one of the many different types. Here's what a lot of people with OCD have. Repeated thoughts or images about many different things, such as germs, dirt, or intruders, acts of violence, hurting loved ones, sexual acts, conflicts with religious beliefs, or being overly tidy, and having to clean up something over and over and over again. Anxiety now, I want to talk about this. Anxiety is an emotion that signals your brain to run for danger or to panic. It sends your brain into panic mode. The problem with this is that that's a good feeling. It's good to know if you're really in danger, but with OCD people, they're not really in danger. They're having unreasonable thoughts, which cause them to panic. And so they're not able to understand that their feelings are lying to them. So, knowing that they can't control them, but they do get some brief relief from just having the anxiety. Even though they don't get relief from the unwanted thoughts and behaviors, they do whenever they have the anxiety, they are able to find some. So, for OCD people, at least once a day, for 1 hour a day, they concentrate on these fearful thoughts, and they do these rituals because that causes them distress. And this gets in the way of daily living for them because they're so focused on protecting themselves from the things that cause them to be afraid that they aren't able to do daily activities the way that normal people are. So also, this makes it hard. Another reason that makes it hard to diagnose OCD is because it's not always visible and it's not even audible at sometimes. Compulsions can be silent prayers you pray in your head over and over and over again. Anything that's repeated that you do, like saying words or even just thinking words over and over and over, that can make it very hard to know that you're OCD because you don't think about it, first of all, because you probably didn't know this until today. But also, the doctors aren't being able to see that. So, and also, symptoms may come and go or ease over time or get worse, which makes it also hard to find it unless it is in the worst stage, because then you know something is really going wrong because it's not going in and out of coming and going or being at ease at points. So, now that we know how some signs and symptoms, let's look at how it gets started and who it is commonly affected by it. OCD, Obsessive Compulsive Disorder, affects men and women and children of all races and backgrounds. The interesting thing about this, though, is that for most anxiety disorders, women are the only ones that have higher numbers of women that have anxiety disorders. But with OCD, it's said that it's fairly equal between men and women to have OCD. About 1 in 100 adults have OCD. That is 2 to 3 million adults in the United States. and that also equals the population of Houston in Texas. About 1 in 200 kids and teens have OCD. That is about 500,000 people, or kids and teens. And honestly, OCD really begins for many people during childhood or your early teen years. Okay, so it also, I do want to add that it's been found that OCD is linked to genetics and can be seen through generations, through families. So now that we know what that is, let's look at ways to treat OCD. First of all, seeing a counselor and being treated with psychotherapy is very important. In psychotherapy, there's another therapy called cognitive behavioral therapy. It teaches the person different ways of thinking, behaving, and reacting to situations that help them feel less anxious or fearful about having these obsessive thoughts or acting compulsively. So, also, there's another form of therapy called exposure and response prevention, which exposes the person to the things that trigger them to make them fearful, but the counselor is there with them and helps them think through it in a different way so that they learn how to deal with it in that different way instead of panicking and curling up into that ball. Some medications that you can take for OCD are anti-anxiety medicine and antidepressants. Anti-anxiety medicine is not usually recommended for long-term because well, it just works for short periods of time and you have to keep taking it over and over again. But antidepressants are generally, in general, more helpful overall. And they do take 10 to 12 weeks before you really start to see the effects of it. But you can keep taking it for the rest of your life, which is what they usually recommend for people who have OCD. Also, I want to teach you I want you to know how to help a person or a friend or a family member whenever they are having an anxiety attack. During these times, it's important to repeat things like that they're afraid of, counteract it with the real truth because their brain is lying to them. So saying things like, you are a good person, those thoughts are not real. You are a healthy person. The thoughts are not true. By repeating those things over and over again to this person, it's helping them. And also, they're going to appreciate it, even though if they don't believe it in the moment, because it's hard for them to see it as truth. It'll help them calm down and make it through that attack. So, now I've taught you how to recognize signs and symptoms of OCD and how to get help or offer help to those that are in need of it. So now let's go back to the basketball game. Now you would be able to help your friend make it through that anxiety attack. And I know that your friend will greatly, greatly appreciate it.